So, very glad to be here today. This is an area of passion for me, talking about autism. But basically, you know, a lot of you may say, well, autism doesn't directly affect me. And I think it affects us all because all mechanism of disease is the same in a lot of ways. So what we're talking about today is really about how all disease connects. Because if you talk about autism, you'll find that you're really talking about autoimmune disease as well, and you're talking about arthritis, and Hal's going to talk about a lot of the points I'm going to mention as far as food and other points. But what we're really talking about is my thing not working. Hold on just a second. There we go. Is about creating leverage, and creating leverage is probably, I like to use that term a lot because leverage is what we're really looking for in disease. How do we create leverage? Just as Hal talked about, how do we create leverage in getting muscles and fascia to release and to heal? How do we create leverage in a bigger sense when we're talking about something like autism? So with that said, I'm going to give you all the pieces of the puzzle, and then Kara's going to follow me and kind of tell us how to tie that in. What is the most important piece of that puzzle? But when we talk about autism, we're really looking at depression, anxiety, you name a disease, inflammatory bowel disease, a lot of these principles all apply. These work. There we go. So we're talking about the inflamed brain when we're talking about autism. Let's boil it down to really what it is. I mean, the more we look at this, I get a bi-monthly newsletter for Autism Research Institute, and they were talking about the autistic child has almost twice as many astrocytes or inflammation-oriented cells in the brain tissue. And so let's just make it simple. No matter what we talk about autism as being, a lot of it is the inflamed brain. And when we address the inflamed brain, then we can really apply leverage to helping these children get into remission. So this is what everybody wants autism to be. This is what I would love autism to be. This is what all of the doctors are looking for, is that magic pill or that magic genetics that's going to help us. Oh, if we address this one thing, then we're going to be able to help autism. It's a lot of different holes, and it just depends on if you've met one autistic patient. You've met one autistic patient, and I'd also throw in there, if you've met one rheumatoid arthritis patient, you've met one rheumatoid arthritis patient. We have to quit looking and putting people into categories like autism and rheumatoid and thinking that all solutions apply to every patient that falls into that category. Categories are, by definition, artificial. It makes us feel better as doctors. Oh, you have multiple sclerosis, or oh, you have rheumatoid arthritis, or you have autism. Now we'll put you into this paradigm, and now we'll follow this flow sheet on what we treat you with. And we're all individuals. We're all really different, and we all have different reasons that lead to the same presentation. So I tell you that every disease is unique. For every person on this planet, they have a unique disease with a lot of the same presentations that we fit into nice, neat categories that really are very artificial, because we have to understand the individual, just like we have to understand in autism that all of these kids are not the same, and they all didn't get here for the same reasons. So one of the main reasons, one of the things I really like to look at is, let's start with the gut, and Hal's going to be talking about that later today, and about foods. And I'll tell you, that's probably one of the more important talks we're going to have today, is how food affects our choices, dietary choices affects how disease presents. And a lot of people say, oh, this is all a fad right now, the gluten thing, the dairy thing, you know, we didn't have this 100 years ago. And there's a lot of reasons why we didn't have this 100 years ago, not to mention the fact that if it comes to gluten, we used to let bread rise for 12 hours. We didn't have the fast rising bread we have now, and a lot of the bacteria broke down the gluten. We've hybridized wheat. There's a lot of different reasons. But if we want to talk about that inflamed brain, you remember that first picture I showed was that inflamed brain. What causes the brain to be inflamed? And so what I tell people a lot is that, you know, it's not like you're sitting on one tack. A lot of these people are sitting on 5, and probably the biggest tack of all that I'll be talking about is the small intestine and the health of the gut in general. And so a lot of these children have constipation. A lot of these children have diarrhea. Very few patients that fall into the spectrum actually have normal bowel movements. I can't count on one hand the number of patients that have come in and had normal bowel movements. It is always a deciding factor in their treatment plan is what we do with the gut. So the small intestine is where it all begins. So the villi of the gut, just to give you some background, this is our small intestine, and it has villi, and it has a very large surface area. And they're much bigger than they look because when you spread them all out, they're bigger than a full-size tennis court. So this is the surface area. Every time you eat, every day, your body has to get a surface area like this that's loaded down with different particles, bacteria, viruses, and it has to decide what's good and what's not good. This is where a lot occurs. So you've got a huge area. So every time you eat, your body is steadily processing. And 60 to 70% of the immune tissue is in the small intestine. You say, well, why so much in the small intestine? I remember in medical school, and this was not that long ago, or I don't like to think it was that long ago. I guess it was 24 years ago. So, but when you look at this, you say, they told me Peyer's patches, we're not real sure why the small intestine has so much lymphoid tissue. And the problem is, today, we're still not talking about why the small intestine and the gut has so much lymphoid tissue, except the docs that are looking like Hal and myself and the functional medicine doctors. We know why there's so much gut in the, so much lymphoid tissue in the gut is because 99% of our environment is actually processed there. 99%. We do more in our gut in a day than the rest of the body really does in the rest of a lifetime. We process more. And so if you're putting something into that environment that the body no longer recognizes as being okay, and you're doing that 3 times a day, how can you expect your immune system to be calm? And the way the gut inflammation affects us is that, you know, a lot of arthritis, a lot of autoimmune diseases, a lot of mental disorders, a lot of neuropathies, a lot of things start because of inflammation. And inflammation gives signals that our body's under attack. When we get the flu, we've had a flu epidemic. And when we get the flu, the body's natural response is to lay in bed, be depressed, and not go out and run a marathon. And that keeps us so our body's resources are focused on fighting the flu. It's a beautiful mechanism that when we get sick, we can't do much. Well, the same thing goes, what if every time we eat, we're creating a flu-like symptom and we got the same symptoms? That's kind of the process we have to think about. When we're eating products, whether it's gluten or dairy or corn or whatever your body may be reacting to, and I'll get into why that's occurring, but we're creating almost a flu-like state. So this is where, when we showed the autistic brain and the brain on fire, this is where the inflammation for most people begins and ends. So when someone comes in for depression, I don't reach for Prozac, I change their diet. I address their sleep. I address their stress, because all of those things directly affect our small intestine. So if we want to get to the root cause of something, we don't need one of my examples I always give, if there's water on the floor, why are we selling mops and not fixing sinks? And that's really what we need to be doing. And when we approach medicine, both as a consumer and as a provider, we need to think about, what am I doing to get to the root cause? And that's the number one thing that patients say when they come in to see me. I want to get to the root cause of my illness. And I think that's one of the greatest things that has occurred since the invention of Dr. Google, is that patients are empowered now to understand that, hey, I don't have to take a pill. I don't have to accept the status quo. And I can actually become my own advocate. And that's what I encourage all of you here today to do, is become a partner with your physician and become your own advocate, because nobody knows you like you do. So we need to get to the root cause, and I'll tell you that inflammation, in my experience, except with things like mold exposure, environmental toxins, and we'll talk about that, but inflammation of what we eat, it doesn't matter what they come in, whether it's Lyme, whether it's autism, what disease it is, I'm always going to start with this point. You always start by healing the gut. So inflammation here, let me reiterate, I like to do that. I like pictures, as you can tell. But inflammation in the gut equals inflammation in the brain. You name a psychiatric disorder. They took, did a study in a psychiatric hospital and made the had schizophrenia patients with schizophrenia and bipolar, and 50% of them almost had complete resolution of their symptoms by being on a gluten-free diet. Nobody's really talking about that, but that paper is there. So basically what we're talking about is leaky gut. You probably have heard of leaky gut. Dysbiosis leads to leaky gut. Dysbiosis is overgrowth of bacteria and yeast. So leaky gut is letting things through the lining. And a better way to think about it is, instead of a regular garden hose, which your gut's supposed to be, it's this. It's letting things through. It's a soaker hose. And so we really need to repair the integrity of that, so that large particles, things that the immune system doesn't recognize, are not causing it to be going into an inflammation cycle. So this is just kind of a summary slide. Gut becomes leaky, has holes in it. Foreign particles leak through and are attacked by the immune system, okay, things that it doesn't recognize. Some people are like, well, I'm allergic to broccoli. Well, and you possibly are. It's not that you're supposed to be sensitive to, or not allergic, but have food sensitivities to, but your body is so, that gut is so leaky, it's letting things that normally are healthy for us through, and the body's just kind of gone into a chaos as far as the immune system, and it's attacking everything. And so with the immune system getting overactivated, it attacks the body, it attacks the brains, the joints, the heart. Most heart inflammation occurs 1 hour after a meal. And that's been shown. So a lot of the damage that we see in hearts and other things are not cholesterol related. Blaming heart disease on cholesterol is like blaming the hole in the wall and the spackling that was used to repair it. It doesn't make a lot of sense. So we need to understand that a lot of what's going on is in our immune system. And when we talk about autism, we're talking about the immune system, and so that's why I focus a lot on that. So, causes of leaky gut. Bacteria, food, and medicines. One of the biggest is one that we all know medicine-wise is proton pump inhibitors. Why do you think you no longer can break down foods? You make acid in your stomach for a reason. You no longer can break down foods. You have very large particles. You don't have acid to stimulate pancreatic enzymes. Now you have no ability to make those large particles small. Those large particles go in. You're not absorbing your nutrients, your magnesium, your calcium, and all of a sudden you developed all the bacteria, the bad bacteria, love large food particles. They love things that have not been broken down. And so you create dysbiosis or overgrowth of bad bacteria, and now you've got leaky gut. So they act surprised that we have increased risk of almost everything when you're on a proton pump inhibitor, osteoporosis, Alzheimer's, you name it, because we're now taking the body's way to absorb nutrients, the things it needs to repair, and gave it more inflammation. So it's not a surprise. So bad food, we were always told, our food pyramid has always been, drink plenty of milk, eat lots of grains. And grains in and of themselves aren't bad. Some of us just don't do well with them. Milk is really for baby cows and fast-growing organisms. I mean, that's the thing we have to remember, that milk was designed for rapid growth because we want to get that cow raised up to the point where it can take care of itself. And so milk is kind of a funny thing in that, and we'll talk a little bit more about that. So gluten, actually, you hear the gluten thing, but gluten actually in and of itself, we've shown that with Fasano's work out of Harvard, that gluten opens the holes. Every time you eat it, whether it's a naive rat that's never had gluten before, they give them gluten and all of a sudden their inflammation spikes because it opens these gateways, these tight junctions. And the problem is a lot of people associate celiac disease with, oh, I don't have celiac, the doctor did test on me, I'm not gluten sensitive. It's about 1% of the 99% of the gluten problem. And there's a lot of reasons why, and I'm sure Hal will explore that this afternoon, so I won't go into that. But there's other things besides just gluten. What is gluten? Just bread, right? Okay, barley and beer, but that's about it. And a lot of people don't understand when we say gluten sensitivity, and some people are really sensitive, what that means. We see it in things like chili beans, soy sauce, oatmeal, imitation crab meat. That's all gluten, actually. I think some of my favorite, being from Louisiana, is jambalaya. When I went through my own journey with my child who was within the spectrum and is thankfully in remission, we loved Zatarans. And so, we were starting our journey. You don't start out being able to run a marathon. And so we thought we were doing well, and we were giving him things like this, and we never understood why his behavior changed. Well, I started reading packages closely, and things like that, it'll surprise you. So if you're dealing with arthritis, if you're dealing with autism, or if you're dealing with any other number of diseases, and you decide to take this out, you have to be careful because it shows up because it's cheap, it's subsidized. So a lot of the foods you see as fillers are not because they need to be there, it's because they're cheap. It's a way to add content very inexpensively. Dairy. This is I say gluten's bad, but dairy for some people is worse. And so, if you want to talk about a bad character, dairy is for a lot of people, and it goes against the grain. And we think, well, really dairy, it's been around, we were told, and if you understand the marketing that went behind dairy in the 1920s and so forth, there's a long story of when the dairy farmers were having problems selling milk. There was a big marketing and some other things that happened there where we were told dairy does the body good. And the problem is, at a little known institution in 1997, they did a large study with nurses, and it showed that nurses who drank 2 glasses of milk had a 50% increased risk of bone fracture. And this institution was Harvard. So I'm not real sure why we don't hear about it, but it's in the paper. I mean, if you look at the research, we see that, the data is there that, hey, this has been inflammatory a long time. And this is not the answer for osteoporosis, although we were led to believe that. And it's sure not the way to look like this. I guarantee you he ain't drinking a lot of milk. So. And look like that. So we are also the bacteria in our gut. We have 100 trillion bacteria in our gut. And when we look at disease, we have to say, and what we're finding is there's more bacteria than there are us. So we're basically a walking hotel. So there's more of them than there are cells in your body. And what we're finding is where the microbiome goes is where the patients go. And a lot of, in autism, we're finding that when we can do a fecal stool transplant, which hopefully will become more utilized in the future as regulations let up, we find that a lot of the symptoms go away. And we find that skinny people can become fat if they get people with stools that are obese, and you give it to a skinny person, then they gain weight. If you take a obese person and give them a skinny person's stool and a fecal transplant, then they become skinny. So this is, our body's getting a lot of information from our bacteria, a tremendous amount. So we can't ever underestimate what we're feeding our bacteria. Are we feeding them fruits and vegetables and fiber and nuts? Are we feeding them McDonald's? And the good bad bacteria and yeast loves McDonald's and a supersized Coke, but your good bacteria do not. That is not how we developed. And so what we find is the more we go back to what we ate when we, 100, 200 years ago, we eat fruits and vegetables and whole foods, these bacteria do tremendously better. And bacteria and immune function, these are my top 3 clues, and I usually see one or both or all 3 of these in a lot of my patients, whether it's autism or another disease. So bacterial insults when a baby, antibiotics as an infant, and there's a lot of otitis media and other things or viral infections that people are going to urgent care for, and they're just put on an antibiotic. And I find that almost every patient that I see has had 5 antibiotics before they're 5. I always ask them, have you been on a lot of antibiotics? Not that many. I'm probably on one once a year when I was, I had a lot of strep and I had a lot of other things. This is a big indicator that you're going to have problems with your immune system. And if you have problems with your immune system, you're going to have problems with inflammation, and you're going to have problems with the brain. And so, in a lot of my patients with autism, I see this. One of the things we didn't realize, and this happened a lot and still does, is the rush to C-section. And we've not seen a lot of increased benefits from doing this increased C-section. But we do see a lot more allergies, asthma, depression, other things associated with the bacteria not being seated in the gut that we're supposed to. When we have a vaginal delivery, we get an influx of bacteria that actually sets us for the rest of our lives. It starts that cycle. Same thing when we get breast milk. Bacterial insults when a baby is young is a lack of breastfeeding. It has all these prebiotics. It has all these things that help the bacteria in the gut. And so, these are some of the things we can do not only to address autism, but a lot of times what I want to do is be preemptive and say, if we want to make sure our kids don't get this disease, these are some steps we can take. We can try to avoid the antibiotics. We can try to make sure we do more natural births. We can do some things like breastfeeding. Breastfeeding is important in so many ways: brain development, IQ points, and we know that a lot of diseases can be prevented in the future with breastfeeding. Toxic chemical exposure, okay? It's all around us. What's different than 100 years ago? What are one of the things we know that we're seeing? I think Kara is going to share with you the rates of autism, but they have skyrocketed in the last 20 years. What are some of the things that have also changed? And that's our toxic chemical exposure. And that is something we have to address, something we have to be mindful of. And our cleaning products, I think there's some really great, I was walking through the booths. I would look at those things because a lot of the essential oils, using thieves, a lot of the things without chemicals, because every little bit counts. Maybe not this one, but if you add them all up over a day and you put a cup of water in the bucket ever so often, eventually that bucket's going to overflow. So the less we can put demand on our detox system, the better we're going to do. And so I like this example. You see this is a satellite picture of the Sweden, and you say, oh, that's beautiful, and what do we expect? Well, that's a river in that country. That's kind of things you would expect. That's a beautiful, no pollution. They're amazing with what they do. And then we get a satellite picture of China. Okay? Unfortunately, they have tremendous amounts of smog and pollution. What kind of results do we expect? Do we expect that same river or this? And this is from their rivers and lakes. They have a lot of fish die-offs because their toxin levels get so high. And I break this point to say we can't give our kids diagnosed with autism, and we can't give ourselves diagnosed with other diseases, we can't give ourselves all these pollutants and expect to be okay. It's going to reflect somewhere. It's not just going to be, okay, we can have beautiful rivers, but we can pollute and have all these toxins. The same thing goes with people. Mercury's a big one. I think we're going to have that addressed today with Dr. Cobb. I'm really, a lot of people, a lot of us our age are walking around with mercury fillings. But thimerosal used to be in a lot of the vaccinations. That's been moved out of a lot of the childhood vaccinations, although they've got a lot of other things, aluminum, that have replaced them, a lot of toxins. But every time you get a flu shot, if you don't get the preservative-free, you're getting mercury, thimerosal. So be sure, if you choose to get the flu shot, that you ask for the preservative-free that does not have mercury in it, because that's one of the nastiest toxins on earth. And yet, it's still not, we're still putting it in people's mouths for fillings, but apparently it becomes magically not toxic anymore once it goes in your mouth. Not so obvious toxins, things we don't think about. Who doesn't love M&Ms? I mean, really. I take away all the joys. This should be called the joyless lecture. I take away everything that's fun, and I'm not done, so just hold on. So, when we talk, your food, we've already kind of mentioned the gluten and the dairy, but, red and yellow dye, guys, these things are banned in almost every other country except here. We can make dyes from natural food products. They do it all the time. They do it in Europe. You can get M&Ms not made with, not saying that's a great food, but every once in a while, that's great. But do you know that they showed that a lot of attention deficit, especially the red, 80% had great improvement with removing red dye. Sometimes these things that we think Stratera or Adderall or these things are the solution, it's not the solution. It's another mop that's covering up the inflammation in the brain. And especially in our autism population, for God's sake, let's not give them anything else they have to struggle with, because we know that plays a huge role, these dyes. Corn. I don't mean to pick on corn. It's a subsidized thing. My daddy does row crops, and I grew up, raising corn. But we find now that it's one of the more abundant grains we have, and so now we're making things like corn syrup. Corn syrup is hard to not find. You pay more to get things without corn syrup now, a lot more. And the reason why I say that is one of the processes that makes corn syrup actually adds mercury into the corn syrup. And so, and this is documented, this is something that we know as far as this process, and there was never anything in nature like this, so why are we allowing this into our body? And won't even go into the GMO aspects. MSG, good, right? Look at your labels. MSG is a brain inflammatory compound. It's one of those things that glutamate is actually an activating factor in the brain that causes excitement. If we're dealing with autism, ADHD, anxiety, why would we put something in the brain that makes us more excited? So look at your labels. It's gonna amaze you when you start reading the labels of things that are supposed to be good for us. They're not so good. This is my favorite movie, Waterboy. I'm kind of known, but aspartame is the devil. It really is. I do not like aspartame. I think if you can put a hot Coke in the sun and it turns into formaldehyde with the breakdown of aspartame, I've never seen a Diet Coke truck in the summertime, have you? Yeah. They sit out in the sun, they get hot, and you're making wood alcohol and formaldehyde when this breaks down. And it's addictive. I truly believe people have a harder time coming off Diet Coke than they do cigarettes. It's been my experience, and we're avoiding calories, but we've shown that aspartame is a direct inflammatory of the brain too. And I find that when people are trying to, I love the Big Mac and the large fry and the Diet Coke philosophy at McDonald's for losing weight. But we find that people that drink Diet Coke actually gain more weight than people that drink regular Coke, because their appetite is stimulated, and we could go into that, but that's not what this lecture is about. But try to avoid those things that aren't natural. And natural sugar is fine in small doses. I'm not saying, oh, he just said natural sugar is good. I want to clarify that because everybody loves to put words in my mouth later going, oh, he said natural sugar is fine. Yeah, everything needs to be done in moderation. I would rather you choose that than this, but natural sugar, we eat almost 150 pounds per American, 100 to 150 pounds per American per year. Our body can handle at most probably 30 to 40 pounds a year. So we really have to be careful because that's inflammatory for a lot of people too. Red dye, I've already mentioned that, but it's in the little things. We're giving our kids Tylenol or Motrin or any of these with red dyes. We love putting red dyes in things. There's strawberry jams with red dye in them. And I'm blown away. I'm like, how red does a strawberry need to be? It's got sugar. Who needs the red? But we're doing those things to our food. So we have to be careful when we're looking at that. Yellow, I think it's possibly worse. Sorry, my slide kind of went wacky there. But, and we give kids Sunny D, which has high fructose corn syrup, no fruit, and mainly sugar, and has both red and yellow dye, and we don't know why they're going to school and not able to focus. You know, we're giving them a Pop-Tart and some Sunny D before they, that's what we've come to believe is a breakfast. So we really have to rethink these things and what we're doing. And if you want both red and yellow, let's give them Gatorade. That's great. You can get both things and high fructose corn syrup. And are the foods we're eating able to survive the nuclear holocaust? Twinkies is one of those foods. I mean, back when I love these, back when I was a boy, but it used to actually be sponge cake and actual cream filling. If you read the back of one now, I love to go to see all the new varieties. I think they've got more varieties of Twinkies now than ever. And it truly, they're good forever almost. So how is something that's good forever really good for our gut? Because these things have things in them that we've never seen before. And the idea is that the food manufacturers, the longer it stays on the shelf, the more profitable it is because it's not going to go bad and has to be thrown away. So shopping on the outside of the store is why that's just a good general rule of thumb. Try to stay on the outskirts of the store because everything in the middle is usually processed, and the whole goal is to keep it around as long as possible. And if you really, and when we talk about autism, we're talking about a kid that's already inflamed. We've already established that the gut's the issue, and we give them things like this. The body is going to react to it in a very bad way because it doesn't know what it is. That's the best way to think about it. Are we evolutionarily designed to handle Twinkies? And food science, I've always thought that was interesting. There's whole professions based on food science, and I think it was done right from the very beginning. Food didn't need science. We just need to eat the foods that already are available, things we prepare with our hands. But we don't need things, and so I think food science is a really funny word. And you think about it, when we talk about toxins, that hamburger that is made from whatever it's made from at a lot of the fast food places, the toxins we're exposed to, the mercury, and all of a sudden we have a real issue with the mitochondria, especially the mitochondria in the autistic patient. The mitochondria in the autistic patient don't work as well. And the reason they don't work as well is because their body is trying to get toxins from all these other places. They're already at a disadvantage, and if you're using up all your resources trying to get rid of all the toxins in your environment, you don't have a chance to take care of your own body. DNA. We would love for autism to be about DNA. And some of it is, actually. As mentioned, I've helped develop a program where we can actually look at DNA and find out what genes are the patients more predisposed to certain diseases and certain problems. And the thing to take away from that is your DNA is really not your destiny. You know, almost 50 years ago, the BRCA gene that we associate with breast cancer, women that had it only had about a 24%, 25% chance of getting breast cancer. Today, they have almost a 90% chance. Has the gene changed, or has the environment changed? And that's really what we're talking about. Our diet's changed, our lack of sleep, our stress. And DNA is turned on and off. What we find is the most important factor is not your DNA, but how well you turn things on and off. You turn off the bad, you turn on the good. And so when we talk about autism, the things I've already mentioned are a huge player in turning on and off these genes. So epigenetics is really what we need to focus on and what we're doing to turn on the good genes. And I believe, and it's been said, disease is 90% environment and only 10% genetic. So if we're looking for the gene that's going to fix diabetes or the gene that's going to fix rheumatoid arthritis, we're going to be sorely disappointed because so much of it, and it's multiple genes. There's not just one gene for any of these. So methylation is one of the things I look at with autism. You don't have to memorize this, but this is how we donate methyl groups and make neurotransmitters. This is how we detox. This is how we repair damage in our DNA. So it becomes really important. And there is an app that we've developed, Kara and I both work on this project called Pure Genomics, and it's free. So you take your 23andMe data, which is now like $79 or $50 depending on the special they're running, and you run it through this application, and you can get a report that tells you, you can see, I've kind of laid myself bare here, you can see my genetics, and this is a supplemental gene report, but it gives us a lot of information about things that may be affected in the body, not always, but it can give us an idea of why they may be reacting a certain way. So genetics is a very fascinating field of study, and it's one that we're going to be exploring more. And what was interesting, I was just telling Kara, I read this week that there is actually a gene. I was asking her, we were talking about why there are more boys than girls in autism. Well, there's actually a gene that can be turned on, or a gene that can be abnormally mutated, that causes much increased production of testosterone to dihydrotestosterone. And so we think it doesn't affect girls as much because this is one of the, we're getting closer to finding some genetic reasons. But this test, the test I just showed you, actually looks at this gene. So I'm starting to get clues of what kids I may want to start looking at. Is this an autistic kid with high testosterone? So that's very exciting. And it's exciting for all of us, no matter what disease you're dealing with. Knowing your genetics is never a bad thing because there's so many, like, you know, how much vitamin D are you going to need to take? We know that now. Sleep. Who has the time? You know, we don't honor our kids' need for sleep. You know, when they're 8 to 10, they're probably needing 10 to 12 hours of sleep. And they really, until they're adult, 8 hours is right. But even as adults, we're getting about 6 hours of sleep a night. And we know that getting 6 hours of sleep a night increases your chance of heart disease almost by 50%. What's interesting in attention deficit disorder and also autism is the fact that most of these kids have sleep apnea. A lot of them do. So this study suggests that sleep problems, especially obstructive sleep apnea, are more common in autism spectrum disorder preschoolers than in community preschoolers. If we're not looking at their airway, And if you've got any type of illness and you're not looking at how well you sleep at night, I would suggest doing that. There's take-home studies now that you can do a sleep apnea test for $200 at home. Lying, I won't go into that. That's a whole nother lecture all in and of itself. A lot of these children, we have to look at lying. I don't care what people say. A lot of doctors don't recognize it. It is rampant. Why some of us react to it and some of us don't. A lot of people are walking around with Lyme disease, don't know it, never will live and die and be happy. Other people's immune system don't do well with it. But we know this is according to the CDC. You can see that, you know, it was hardly recognized, and now they think they're missing about 1,000% of the cases. It's almost 10 times higher than they think. So it's something to consider when we're dealing with a disease like autism. And unfortunately, in almost every one of my patients with autism, they do have Lyme disease. The inflamed brain, that's really what it comes back to. What are we doing to help with inflammation? We're addressing the diet, we're addressing the sleep, we're addressing infection, toxins, all of these things. But we're not just talking about autism, we're talking about almost every disease. Addressing inflammation is the key. Some of the things I like to give, poor absorption, some things that are helpful. Vitamin D3, one of my favorite. They showed that women that already had an autistic child and they have a 20% risk of having another child with autism. If they gave those women 6 months before pregnancy, during pregnancy, and after pregnancy 5,000 units per day of vitamin D, they decrease that risk to 5%. That's a 300% decrease in the risk of autism. This is a good paper. It had good, I mean, it was well done, and they showed a 300% risk in autism. Nobody's talking about it. We're not talking about a 10 to 20% per day solution for autism. And that is mind-blowing to me that we're ignoring this. So, you know, and milk is not a good source. It's D2 that's in milk, not D3. We need D3. The child also needs to be, breast milk does not have a lot of vitamin D in it, so any child needs about 500 to 1,000 units a day in vitamin D oil that you could put on the breast when they breastfeed, and that will be huge, and that also helps prevent autism. Magnesium, you want to calm the brain. This is one of the easiest ways, cheapest ways. You know, asthma, depression, you name it. There's a great book I read when I first started called Magnesium Miracle by Carolyn Dean. It is pretty amazing that something so cheap, and I'm not talking about mag oxide, which is good for putting in your garden and letting your garden uptake because your body doesn't. It makes you poop, but that's about it. If you want something that absorbs and goes to your brain, you want to look at one of the good things like magnesium glycinate, taurine. Probiotics, we talked about that. Probiotics as a whole don't tend to stay in the gut forever, so you're really giving your body support for maybe 7 to 10 days. There are some that we're starting to explore that may create diversity in the gut and also stay, but most of them you want to make sure they're human strains, and so when you take them or you quit taking them, you've kind of lost the benefit after about a week. So unfortunately, probiotics are something we probably need to take long term. Fish oil, and I spell it this way because I don't know how to pronounce it. This is I just really can't. I don't know why. It's oil. So we really want to look at 1,200 to 900 milligrams a day of this. What fish oil does, and I'm in an immune course right now with a great immunologist that I'm taking online, and it actually dampens the chronic inflammation pathway through something called resolvins and protectins. And that's why fish oil is so beneficial, because it dampens the chronic inflammatory response, whether it's autism, whether it's depression, whether it's rheumatoid arthritis. It is helping with that inflammation that we talked about earlier. Zinc, B complex. Zinc is, in a lot of these children, is low. It's part of a condition. called pyroluria. And so zinc and B6 are two of the things I often find that my kids really respond to. And just summing it up is that inflammatory diet environment leads to poor detox, genetics, infections leads to uncontrolled inflammation, and that leads to autism. It really does become, you know, it's kind of almost how you have to think about it is where's the inflammation coming from and how do we control the inflammation? The things I've given you today kind of give you some solutions to that. Now, with all that said, that's great in theory. Everything I told you is great in theory. Okay, take everything I've just said and said that's great in theory. And you go home, let's say you have a child with autism, and you go home and say, I'm going to do all this, but I'm just going to do it for him, and I'm not going to make anybody else in the family make any of these changes, and the dad's not supportive. Oh, the finances are too much. I don't know how we're going to make this work, so we start sliding downhill in a week, and in 2 weeks, and then a month later, we're back to where we started. Oh, that didn't work. Well, it very well could have worked, because what's happened in the autism community, we've jumped from one thing to the next. We've moved to one magic hammer to the next magic hammer to the next magic hammer, and nobody's put it together of how do we create a program that's sustainable. And the same goes with any disease process. How do I create, as a physician, something that's sustainable for my patient? And I think Kara, who's going to be our next speaker, has done the best job of anybody, and that's actually why we partnered years ago, is because I said, you've got the solution. You understand how to create real change in autism. And so that's what we're going to be talking about next, that missing piece of the puzzle. All the things I talked about, she already had put together when I met her, and she's going to tell you how to make it stick when you're talking about, and the program that she has devised that I think is one of the best in the country. So thank y'all, and look forward to hearing Kara speak next.